previous lecture of malaria. Today we will discuss the diagnosis, treatment, and prevention. So, in regard to the diagnosis of malaria, the first step, and sure, you have heard that in certain cases, when you see a patient who has a febrile illness and you suspect malaria, it's a routine to request this, which is thick and thin blood film, because as we know, and previously mentioned in the last lecture, that it's the parasite, the Plasmodium, it invades the RBC. So blood film or blood smear is an important method to diagnose malaria. But here we will use two types of blood film, thick and thin blood film. So these should be taken whenever malaria is suspected. Stage of the parasite, from the early ring stage to the later trophozoite to the schizont, and maybe also the gametocyte, which is the last stage. So it can show us all the stages of the parasite. And in case of thick blood film, more blood is used in the thick blood film. These 2 points help us in the diagnosis of low level of parasitemia, because, as we said, we use more amount of blood in the thick film and can show us all the stages of the parasite. So if there is low level of parasitemia, it is detected by the thick film. Regarding the thin blood film, again, it can help us to confirm the diagnosis, but here it's of benefit to identify the species of the parasite. So it can give us more details about the morphology, by which we can differentiate between the species of the Plasmodium, whether it is Vivax or Valley or Falciparum. The other point is that in Plasmodium falciparum, it can help us to quantify the parasite load. This is by counting the percentage of the infected erythrocytes, because this is one of the points to determine the severity of the condition. As we have mentioned in the previous lecture, we said that one of the complications is hyperparasitemia, in which more than 10% of the circulating RBCs or parasites are parasitized in non-immune patient with severe disease. So the thin blood film help us to confirm the diagnosis, identify the species, and in case of falciparum, to define the parasite load. In Plasmodium falciparum, parasites may be very scanty, and the load may be very scanty, especially in patients who have been partially treated. With Plasmodium falciparum, only ring forms are normally seen in the early stages. وتقريبا the earliest of the early stages of the parasite in the RBC, the earliest one is the ring form. So it is seen in case of Plasmodium falciparum. With the other species, the Vivax, the Ovale, and the Malari, all stages of the erythrocytic cycle may be found. اللي قلنا عليها هي تبدي من ال ring stage, trophozoite, schizont, and last one is the gametocyte. بس حاليا احنا بالنسبة للبلود فيلم صار عندنا بالنسبة للفالسيبارم اللي يفرق عندنا انه we can quantify the parasite load, and the parasite load may be very scanty, especially in those who have been treated partially. And mostly we can only see the ring form, which is the early stage or the early RBC stage of the parasite. Whereas in other species, all stages of the all the erythrocytic stage of the parasite may be found. Gametocytes appear after about 2 weeks. يعني هي هاي the erythrocytic cycle of the parasite تبدي من الring form وتنتهي بالgametocyte. فالgametocyte appear after about 2 weeks. Gametocyte persists after treatment, but they are harmless. The only thing that they are the source for infecting the mosquitoes. وإذا تذكرنا احنا بالمحاضرة السابقة ذكرنا شلون يصير الترانسميشن. The female Anopheles mosquito becomes infected when it feeds on a human blood containing gametocytes. Okay, the gametocyte, it is the stage that infects the mosquitoes and then can transmit the infection to another person. So this was about the blood film, the thick and thin blood film. The second way of diagnosis is immunochromatographic rapid diagnostic tests. They are tests to detect malaria antigens, and they should be used in parallel with the blood film. يعني we can use it as another method to confirm the diagnosis. لكن يعني besides the blood film ما استخدمه كبديل عن blood film. Blood film I should use it. يعني قد ما بس for the diagnosis مفيدني كذلك to identify the species, to quantify the parasite load. Okay? But this is another way, rapid diagnostic test to confirm the diagnosis. The last method is the DNA detection method, which is the polymerase chain reaction, PCR. This is used mainly in research laboratories, and it's useful for determining whether a patient has a recrudescence of the same malaria parasite or there is a reinfection with a new parasite. ذكرنا احنا سابقا ممكن انه patient who have been infected later on he may have a relapse. فهذا البي سي ار يفيدني لانه تعرفون انه and again there is relapse of the same symptoms. فأنا هون أريد أعرف أنه this is a relapse of the same of the old parasite, the same one, or there is a reinfection with a new parasite. This is by detection of the DNA. So, in summary, diagnosis depends mainly on blood film, thick and thin, and we may use other tests which are the rapid diagnostic test and PCR. Regarding treatment of Plasmodium, treatment of malaria in general, treatment should be supportive. Okay, to start with, patient should have rest. Okay, maintain adequate fluid intake, use of antibiotic when indicated. Then we have the specific treatment, which differs also by the species. So, for Plasmodium vivax, ovale, and malaria, they all should be treated with oral chloroquine. صراحة أنا ما أعطيتكم الدوزز، بس يعني خلينا نقول تاخذون اسم الدواء، لأن الدوز شوية صعب عليكم الفترة الحالية. Their treatment is by oral chloroquine. Radical cure in case of Plasmodium vivax and Plasmodium ovale malaria, using a course of primaquine. which destroys the hypnozoite phase in the liver. ذكرون بالمحاضرة السابقة قلنا اللي يميز البلازموديوم فايفاكس والبلازموديوم اوفالي عن other species and they have the dormant stage, the hypnozoite in the liver, which can be a source of another infection later on. So to achieve a radical cure, يعني حل نهائي، يعني علاج نهائي، ما بس انه for the current يعني erythrocyte infestation، حصل انه radical cure I should cure the or eradicate the hypnozoites in the liver. So besides using the chloroquine, I use a course of primaquine. Destroy the hypnozoite phase in the liver. Hemolysis may develop in those who are G6PD deficient. يعني هو معروف anti-malarial treatment. It's one of the causes of inducing hemolysis in people with G6PD deficiency. Now we come to the Plasmodium falciparum. هسه بالنسبة للPlasmodium vivax, ovale, and malari, they have the same line of treatment. Which differs is the Plasmodium falciparum. So for uncomplicated Plasmodium falciparum malaria, previously it was used. It was used to the patients also with chloroquine, but now Plasmodium falciparum is getting resistant to the chloroquine almost worldwide. يعني resistant صار تقريبا كل العالم. يعني بعد خرج من ال guideline انه يكون كتريتمنت for falciparum. فناw an artemisinin based treatment is recommended. Artemisinin based treatment using the agent co-artemether or co-arteme اسم التجاري ماله as 4 tablets يعني at each time of ingestion 4 tablets لكن بيها يعني certain times day 0 8 عفوا at hours 0 8 24 36 48 and 60 يعني for 6 doses at certain times at certain hours and 4 tablets at each time. Okay, so an artemisinin treatment اللي هو the co-arteme. This is the standard treatment. The co-arteme given for 6 doses at hours 0 8 24 36 48 and 60. Alternative سنستخدم انه other regime ممكن يكون بديل عن الco-arteme are the alternatives are quinine also orally. It's given daily for 5 to 7 days. So this regime, the alternative regime, has 2 steps. First step, for 5-7 days we use the quinine, then we follow it by either doxycycline for another week or clindamycin also for 1 week. We prefer to use clindamycin for young children and in pregnancy because both childhood and pregnancy are contraindications to the doxycycline use. So doxycycline should not be used in pregnancy, and the co-artemether, the co-arteme, should be avoided in early pregnancy. So the solution in pregnancy, we use the alternative regime, which is quinine plus clindamycin. So the standard treatment is the co-arteme, 6 doses. Alternative is quinine for 1 week plus either doxycycline, followed by either doxycycline for 1 week or clindamycin for 1 week. In pregnancy, we use the alternative regime, and the second agent is the clindamycin. In case of complicated falciparum malaria, severe malaria should be considered in any non-immune patient with a parasite count greater than 2% or with complications. يعني أنا إيمتي عادة أنه malaria is يعني falciparum malaria is severe one. إما يكون عندي any of the complications that we mentioned before، يعني اللي قلنا عليه cerebral malaria, convulsion, hypoglycemia, severe anemia, aspiration pneumonia, shock, the acidosis, all the and the bleeding disorder and the coagulopathy, acute renal failure, all these complications, if they are present, any of them, we label the malaria as severe. Or if there is parasite count greater than 2%. Management of, so all the severe malaria is a medical emergency. Management includes early and appropriate antimalarial chemotherapy. They should give chemotherapy for malaria. Treatment of the complications. Supportive treatment, which is correction and maintenance of fluid balance, correction of electrolyte, acid-base balance, and avoiding of any harmful and ancillary treatment. The treatment of choice in case of complicated or severe falciparum malaria is an intravenous agent. So in the uncomplicated, we mentioned that the coartem, 6 doses. In the complicated and severe, we use the intravenous artesunate. 3 doses in the first 24 hours, and then once daily for 7 days. Once the patient is able to commence oral intake, we change to the oral form of the medication in a dose of 2 mg per kg. Our aim is to complete a total cumulative dose of 17 to 18 mg per kilogram of body weight. So in severe malaria falciparum, start with intravenous artesunate, 3 doses on the first day, and then once daily for 1 week. Once the patient is stable and can take oral fluids, then we can switch to the oral form of the medication. A total cumulative dose، يعني بحيث انه مجموع اللي ياخذ الدوز تكون توصل عنده انه كان اخذ بالفتره كلها ما يعادل 17 الى 18 ملغ لكل كيلو من وزنه. Exchange transfusion may be beneficial for non-immune patients with persisting high parasitemia، يعني more than 10% of the circulating erythrocytes. Here, if you have 10% and more parasite load, here you should consider exchange transfusion اللي هو يسمونه تبديل الدم. يعني it's not just a blood transfusion، ما انه خلينا نقول مجرد انه مريض ياخذ دم، مثل ما جزء من المستشفى مريض ياخذ دم. هون exchange، يعني replace his blood volume with an equal volume. Okay. The aim is to get rid of the high parasite load. ولهذا احنا قلنا الستين بلاد فيلم يفيدني انا بحالة الفالسيبارم مناقل، انه يفيدني حتى to define the parasite load, the percentage of the affected parasites. Alternative therapy in case of complicated and severe falciparum malaria. I will start with quinine, but again the intravenous form. So I give a loading dose of quinine. It's 20 milligram per kg over 4 hours. Then maintenance dose of 10 milligram per kg given as a 4-hour infusion 3 times daily for the first 48 hours, and then twice a day until the patient can take the drugs orally. يعني احنا اللي تعرفون بالنسبة للalternative we can use the intravenous quinine, okay, until the patient again is able to take oral, and then we can change him to the oral form of the quinine combined with doxycycline or clindamycin. يعني نفس حالة ال uncomplicated اللي ذكرناها قبل شوية، quinine orally followed by either clindamycin or doxycycline. هوني استخدم الكنين لكن in the intravenous form. بعدين ممكن انه احول على الاورال form. هوني combined with doxycycline or clindamycin. الملاحظة المهمة هون إنه patients should be monitored by ECG while receiving quinine. The special attention to QRS duration and QT in intravenous form. They are liable to have some arrhythmias and abnormalities in the ECG. So it's important to put a patient on a monitor, an ECG monitor, to detect any abnormalities as they occur. This is an important point in quinine therapy. If you choose to use the intravenous quinine, should ensure that patient is put on an ECG monitor. Regarding the prevention. Prevention, in fact, consists of two things. First of all, prevention, trying to prevent the mosquitoes and the mosquito bites. And the second is prevention by using medication, especially those who are intending to
Please announce yourself.
screened windows and using the insect net. يعني التيل تستخدم مهم. Use of a mosquito net, especially يعني on over the beds. Okay. كذلك انه نستخدم مثل ما قلنا التيل مع الشبيبي. حتى ممكن إنه يعني the net is put over the bed حتى يعني to avoid يعني mosquito bite during sleep. فالقصد إنه anything to avoid the mosquito bite. The next step in the prophylaxis is the chemo prophylaxis. So, clinical attacks of malaria may be preventable with chemo prophylaxis using chloroquine, atovaquone plus proguanil, doxycycline, or mefloquine. And any of these, either chloroquine or atovaquone plus proguanil or doxycycline or mefloquine. The risk of malaria in the area to be visited and the degree of chloroquine resistance guide the recommendations for prophylaxis. احنا مثل ما ذكرنا قبل شوية بالنسبة للفالسيبارام malaria ان they are almost resistant to the chloroquine. فهوني choosing which agent to use for prophylaxis is guided by the risk of malaria in the area intended to be visited and the degree of resistance to chloroquine in that area. فخاصة إذا كانت an area endemic with falciparum malaria ما أفضل أنه أستخدم الكلoroquine as a prophylaxis. ممكن أستخدم any of the other agents like the mefloquine, like the atovaquone plus proguanil. Okay. Mefloquine is used in areas of multiple drug resistance, such as East and Central Africa. Experience shows it to be safe for the last 2 years, for at least 2 years. But there are several contraindications to its use. يعني هسه احنا بالنسبة للميفلوكوين it may be time being is maybe the best agent in regard to the resistance to drugs. And the resistance of the malaria species to this drug is very little. تقريبا يشتغل على كل strains. لكن انه and it is also shown to be safe for at least 2 years. And you follow up on a patient who used mefloquine for 2 years, it is safe. Lacking there are some conditions which are considered as contraindications to the use of the mefloquine, like in first trimester of pregnancy, case of lactating mother, case of cardiac conduction disorders. قبل شوية حكينا عليها قلنا بحالة الكنين ممكن كذلك mefloquine can have the same thing. ولهذا احنا قبل شوية كنا النقطة بس حتى لها كثر عليكم ما ذكرناها لأنه يعني if not be given the loading dose should not be given if quinine or mefloquine has been administered in the previous 24 hours. وكذلك انه حاول اذا كان انه using quinine and then using the mefloquine may pose an extra risk for cardiac conduction defect يعني خلل بالكهربائية القلب. فإذا كان أصلا عندي أنه established cardiac conduction defect ممكن أنه يؤثر لي على اختيار الagent. So first trimester pregnancy, lactation, cardiac conduction defect, epilepsy, patient يعني عنده صرع, and psychiatric disorders. Mefloquine should be started 2 to 3 weeks before traveling to the area to give time for assessment of the side effects. مع الصوت واضح؟ صوت واضح عيني؟
نعم دكتور.
Okay. So mefloquine should be started 2 to 3 weeks before traveling to the intended area. Regarding the pregnant, احنا قبل شوية قلنا الميفلوكوين I cannot use it in pregnancy, especially in the first trimester. So, which agent to use in pregnant or in a lactating lady? I can use as a prophylactic agent the chloroquine or the proguanil. Okay. Regarding, there are ongoing efforts to produce a fully productive vaccine for malaria, but still it is not there. But efforts are continuous to produce this vaccine. So regarding the prophylaxis, first control of the mosquito, second chemo prophylaxis. I choose the agent for prophylaxis according to the risk of malaria in the area to be visited and the degree of resistance to the chloroquine. So I can use the mefloquine, which has the best action, but there are some contraindications to its use, like pregnancy and lactation, psychiatric diseases, and epilepsy and cardiac conduction defect. In case of pregnancy and lactation, I can use the proguanil or the chloroquine. And thank you. Any question?
السلام عليكم دكتور.
وعليكم السلام. أهلا وسهلا.
دكتور، بالنسبة للمواعيد مع الإصابات بالفيفر بالملاريا، نحن بالباراسيتولوجي أخذنا إنه الفايفكس والأوفالي والفالسيبرم كلهم يسببون ترش الملاريا، والملاريا يتسبب الكوارت الملاريا. فكنا نقول بالترش الملاريا يصير عندنا every third day الفيفر تبدي تصير relapsing يعني. بينما بالكوارتن every fourth day. نحن عندنا محاضرتنا هوني مكتوب إنه بالترشن الفيفر on alternate days، بينما بالكوارتن مكتوب every third day. فما أعرف إيش تصير هوني.
احنا اللي هو الشائع كان بالنسبة للملاريا إنه كان هو يعني fever every third day، اللي هو tertian. لكن احنا اساسا يعني بآخر طبعة مع ديفيدسون اللي قد نمشي على إنه هي هاي البيريودستي اللي قد نمشي عليها. فهو أكثر شيء هو الترشن تايب هو للملاري، بلازموديوم ملاري.
يعني دكتور إنه هي مع كوارتن، نحن لين دائما يمكن نقول عليها كوارتن، وكوارتن ربطناه مع الفورث داي.
ايه بس لا يعني هسه احنا يعني قلت لك اللي على اخر طبعا مع ديفيدسون انه هو الترشن هو الملاري. اكثر نوع احنا من الموجود عندنا بالعراق والحقيقه هو الفايفاكس. فممكن انه يعني خلينا نقول هو يكون on alternate day الفيفر. لكن هم كذلك انه توشع انه sometimes patients present with انه history that they have fever every third day or every fourth day، يعني certain pattern. لكن هسه حاليا انه قلت لك بالنسبه احنا نمشي على ديفيدسون، هو هذا اخر طبعه، فانه said انه on alternate days، يعني every 48 hours تقريبا يصير عندنا relapse.
هو دكتور نحن قلنا 48 hours بالفايفكس والأوفال، بس بالملاريا نحن ما مكتوب عندنا محاضرتنا، بس هي أتصور بس هي اختلاف بالبرسبكتيف دكتور، يعني إنه هل يحسبوها من أول يوم لو يحسبوها من بعد أول يوم، من الفيفر.
هسه مثلا يعني عندك مثلا بالفايفاكس والاوفالي، يعني هو البيشنت لما مثلا يطيق اعطاك الهيستوري مثلا قال لك الساعه 12 الظهر صار عندي، طولت عنده احتمال مثلا ساعه ساعتين هكذا. ثاني يوم ما عنده شيء زين، يعني ثاني يوم بال 12 الظهر ماكو عنده شيء. اليوم اللي بعده هم بال 12 الظهر تقريبا تصير عنده. فهو ان alternate day، يعني يوم ايه ويوم لا. بس هي تقريبا اذا تحسبها بين يعني بين اتاك واتاك تقريبا هو اكو 48 hours.
تمام دكتور. هي alternate إذا انضحك عليها يعني بدءا من أول يوم، بس
ايه
من بداية الفيفر من أول يوم، يعني هي
ايه
ثالث يوم يعني تصير فعليا.
ايه يعني الى ان تجي الاتاك اللي تقريبا يعني يكون 48 او even more.
م-م. وتصير نفس الشيء مع الكوارتن، يعني الكوارتن تصير مثلا أول يوم، بعدين ثاني يوم
ايه
ثالث يوم ماكو،
ثالث يوم
ورابع
ماكو.
إنما
بالضبط.
ثالث يوم ما بعد اليوم الأول.
بس هي هاي المصطلحات ما ظلت، فلهذا ما خليناها بصراحه بالمحاضره.
أوكي تمام دكتور، عشت لك.
يعني سؤال يلا. شكرا جزيلا.